So I wanted to come on today to talk to you a little bit about disc injuries and particularly those that affect the lower back. Now it's something that as a chiropractor I see quite a lot of in clinic, and one of the first things that I need to do when I suspect that someone's got a disc injury is actually check this muscle. So if I just show you here, this is the gluteus maximus and it's the biggest muscle in our body, and that muscle is quite often quite sleepy on people because we spend a lot of our day sitting around on our bottoms, and that muscle becomes weak and inhibited. And I'll show you why that's a problem. So when somebody comes into clinic, quite often we see them and they come in and they're in this position. It's really not very comfortable for them. And so they're walking and they're like this. And when I ask them if they can stand upright, we get this action. So the hands walking up the thigh to help return the body to upright. And that is a classic sign that the gluteus maximus, so the big muscle in your bottom, is weak and isn't firing properly. And that is a problem because it puts too much strain on these little muscles, which are the deep muscles that sit in between the joints in our back. So they sit in between the vertebrae in our back, and those muscles are nowhere near as strong as the gluteus maximus. So when the gluteus maximus isn't working properly, those muscles in our lower back have to work to try and help pull us upright, and they just can't do it. It's like anyone who's overworked, they get to a point where they say, actually, I've had enough, and that's how we can end up with disc injuries. So one of the first things that we do when we see you in clinic is we'll check whether you've got what I call sleepy bum syndrome, which isn't a technical term, but we check and see whether that gluteus maximus is working properly. So that's some food for thought for you on a Wednesday morning. It was lovely to chat to you, and I'll speak to you soon.